You know, I got 98% of what I wanted. I'm pretty happy.
It may have appeared at first that the federal spending cuts, known as the sequester, might not cut too deeply. But as some Medicare patients who need chemotherapy are learning to their dismay, there's some real pain in the process.
How are you?
72-year-old George Rosses is in the fight of his life, battling lung cancer. He and his wife Linda are very happy with the care he's receiving at this clinic near their Long Island home. That may soon change, and Linda may have to start taking time off from work to drive George to a hospital for chemotherapy.
I am upset because to think if this is what's going to happen, you know, my concern is for George too, and I want nothing but the best for him.
Most medications for seniors are covered by Part D, which is exempt from the automatic budget cuts. But cancer drugs must be given by a doctor. So chemotherapy falls under Medicare Part B, which is being cut by 2%.
It strikes me as being insane.
Dr. Jeff Asurka is the chief executive of North Shore Hematology Oncology Associates, where George Rosses is a patient.
We can't go to the point where we're actually losing money when we are giving chemotherapy drugs. That's not going to, in the end, do any favor to our patients because we wouldn't be able to stay in business.
Here's why cancer clinics say there's a problem. Medicare reimburses oncologists for the cost of chemotherapy drugs, then adds an additional 6% to cover the cost of storing and administering them. Cancer centers say their profits come from that 6%. Judith Stein of the Center for Medicare Advocacy says that these clinics are profit centers and should be able to absorb these cuts.
It's hard for me to believe that a 2% cut is so significant that they cannot treat the people they are in business and ethically bound to serve.
But consider how much money is involved with an expensive cancer drug like Avastin, which costs between $80,000 and $100,000 per year. Do you have a dollar and cents figure what this could actually cost you?
What we looked at initially is somewhere north of $800,000 in the red.
Patients will still be treated, but many, like George Rosses, will have to go to hospitals for chemo. In one recent survey, 72% of community oncology clinics said they'll require secondary insurance for Medicare patients or have to send them elsewhere.